Hi, my name is Jerry Dhillon. I'm based here in London, and I'm a health and movement coach. And today I'm speaking with a really old friend of mine, and his name is Dr. David Aronoff, and it's quite topical. And I'll let him explain who he is and what he does.
Great, thanks, Jerry. My name is David Aronoff. I am a physician and I specialize in infectious disease medicine. I'm also the director of the Division of Infectious Diseases at Vanderbilt University Medical Center, which is in Nashville, Tennessee in the United States. And so I'm joining Jerry through the power of electrons across continents. But we have a long history together and spent time at university together back in the day. So it's a real honor and pleasure to be able to connect in this way.
Yeah, it's absolutely wonderful. I mean, that we've got this technology, and we're in this position is in this stage of our history to be able to do this. And one of the reasons I wanted to talk to you anyway, David, because I had a few questions, and I thought it'd be interesting to kind of share this out for other people as well, because with all this stuff about COVID going on right now, it seems to be quite contained within country to country, and each one's insular in how they're dealing with it. But we have this kind of, well, in the West at least, I think, there's been an approach of first of almost denial, and now it's acceptance, and slowly as it starts becoming a bit more real in terms of we start seeing what the effects of this are, and we're dealing in this kind of a lockdown state eventually that everyone's kind of going towards, and different countries have kind of dealt with it separately, and it'd be interesting just to kind of find out from what's happening there in the States. I mean, I know in terms of the trajectories, in terms of New York, I think we're in a similar state to where we are here in the UK. What's happening with, I mean, if you can, from your perspective, what's happening in the US?
Yeah, it's a really interesting situation. The US is so large and it's broken into states, and a lot of the healthcare and regulations of healthcare differ from state to state. The healthcare system in the United States is very different from the way it is in many areas of the world. And COVID has been sort of slowly migrating its way through the United States. And in the greater scheme of things, it's not that slow. I mean, it's gone from just being recognized as a problem in China at the really turn of the year to now being everywhere. But I live in Tennessee, which is somewhat in the middle and southeast of the United States. And we've been sitting here watching it advance across Europe, advance into South Korea, advance to the coasts of the United States. And there's been some federal response, but a lot of the basic response in terms of what you say, lockdown, or really trying to enhance people's social distancing and slow the spread of the virus, has been not only from a top-down policy approach, but really a bottom-up approach of engaging local governments, city governments, and then state governments to try and predict, wow, when is the virus going to be here? When is it going to potentially overwhelm the healthcare system in our state? And when is it appropriate to shut businesses down? And this has been the biggest, I think, counterweight to aggressively going into public health measures of everything that can be done to protect society and enhance social distancing, has been this economic concern about, gosh, what happens if we shut our restaurants down, or we shut our bars down, and our parks and our schools? And that has been quite a patchwork of various municipalities and state governments sort of activating and deactivating this shutdown. It's been really interesting to watch. It's almost like watching a building at night and seeing the lights come on and come off at different times. It's been that with sort of policy around COVID throughout the United States. Right now in Tennessee, we're still seeing new cases every day, and some days bring more cases than the day before. We're not really on the backside of this pandemic in Tennessee, but we also have not overwhelmed our healthcare capacity. We haven't run out of intensive care unit beds or mechanical ventilators, which has been a concern for sure. But we're starting to see people think maybe now we should relax our guard, and maybe next week we can start, no longer closing restaurants and bars. So it's really, there's a lot of tension around that here. I don't know. It may be very much the same in the United Kingdom.
Yeah, well, as you will probably know, with Boris Johnson being admitted to intensive care, I think that probably had a bit more of an impact. I think, with realizing, this is like a non-discriminatory disease, that can hit anyone at any one time. So it kind of makes it a little bit more real. But then again, because we're just getting into kind of spring, summer here, so weather's getting a bit better, and with the Easter break and all this sort of stuff coming along, still quite a lot of people out on certain days. If it's a nice sunny day, I remember the first day was when it was really sunny. Was quite surprised, how many people were out there, and hearing reports of like about 3,000 people in parks and stuff like this. Yeah. I can understand it's kind of hard to kind of get out and to remain contained, and we need that social interaction. But still, at the same time, if we've got to get a handle on this, then we should be kind of. It's almost like, I think there's been a couple of scenarios of the way I see it. Your views may be different. I think there was some countries that had probably had previous experience of this, Asian countries in particular, because of SARS. So countries like South Korea were able to kind of get it under control, but still, they're still in a lockdown state, I believe, from now. And the way they were able to kind of get to that, because they were prepared with testing and the facilities that they had. And I think the trackers that they had on their phones were really useful. A good way of kind of monitoring who potentially has this. And until we get that kind of level of similarity in terms of how we're all addressing this across boundaries, then I don't see how it's going to be fully contained. What's your view on that?
Well, I think you're exactly right. We increasingly need to be thinking about the world in a global community sense. And with travel as frequent as it was, at least leading up to this pandemic, and as populations rise, and as we continue to reduce land mass for wild animals, and expand our need for food, we're going to see more possibilities for pandemics, more likelihood that viruses like this COVID-19 virus can move from one species of animal to another. And I think moving forward, if we're going to optimally defend against the burden that a pandemic can impose, we need to have our shields up, and we need to be thinking about how do we help each other across countries, across, as you say, typical borders. These viruses certainly don't respect borders, and I think what we're seeing play out is exactly a reflection of a combination of preparedness for this sort of pandemic and ability to mobilize and really encourage even just individual citizens to participate in the things that it takes to slow the spread of this. So, I think we're going to learn a lot on the back end of this pandemic about what we could have or should have or would have done had we known. And now I think we'll be in a position, at least in the foreseeable future, to not have an excuse for not being prepared the next time.
Yeah, I agree. It's one thing I was thinking about was I know there's been talk about, I think from day one, everyone's like, well, how do we contain it? Okay, we don't want to contain it too long because, like you said, of the economic situation, and nobody wants to kind of shut down totally, but we've had to do it anyway. So beyond that, then now there's been this race for the search of a vaccine. And maybe you could share with us, I mean, what's happening on that front? I mean, is that again, country to country, everyone's working by themselves? And because I can see some sort of political factors here as well, because I mean, if it was China or, you know, the US or somewhere in Europe or Japan, or whoever it may be, to say, oh, look, we found the vaccine, we're the saviors of the world, you know, it's that sort of flavor that I'm feeling slightly, because I don't know how willing and able the Chinese authorities have been, for example, in sharing what they know about it. Because certainly there were talks about, you know, the whistleblower, and they were trying to contain it in terms of, you know, letting the knowledge be known that it was out there. Is there some international kind of effort that's actually going towards this?
Yeah, it's a really good question. So I, as you know, am sort of ever the optimist. And I think when it comes to something like a life-threatening global pandemic, that has a way of opening a lot of typical barriers. And certainly in the scientific community, there's been just amazing amount of open sharing of data around this pandemic, sequencing of viruses from all over the world, and sharing knowledge about how to develop drugs and develop vaccines. People are putting research even before the typical peer review process is completing, just putting stuff out there for people to learn, understand, and critique in a very open way. I think typically in academia and science, even industrial science, there's a real desire for the greater good, and to not be highly balkanized, and to really share. I think there's also that tension around profit and intellectual property and ownership and nationalism that are all counterbalances to those sorts of efforts. But in the face of a pandemic, you have these great non-governmental organizations like the World Health Organization, and even movers and shakers like the Bill and Melinda Gates Foundation, and others who are really advocating for people to do the right thing, share data, share knowledge. And you know, I know here at Vanderbilt, you know, even here in the middle of the southeast of the United States, we are participating in some clinical trials of treatment for COVID that are international studies. And so we are one of several sites around the world that are all engaged on a scientific front. So, you know, I think this is a time when concern about profit margin or concern about intellectual property has to take a little bit of a back burner to the front burner issue of saving lives and preventing the spread of the disease. And I think we're seeing that. I think this will be a good, you know, we see that every year with the flu, even, where flu vaccine is generally widely distributed, and understanding about how to make it is global, and it tends not to be terribly nationalized. And I'm certainly ever the optimist that we're going to see that. Sure, there could be the occasional company that hoards something, or the country that doesn't let some intellectual property go. But, you know, to be honest, I think that's going to be the minority here. And we're going to see solutions that are not, these are mine and not yours kind of attitudes. At least that's my real hope.
Yeah, well, if we certainly kind of hope towards that. But, you know, I mean, all you tend to hear in the news is mainly, you know, it's this many kind of cases and this many amount of deaths. And because we're still, I mean, here, as in, like, for example, in many places as well throughout the world, we're trying to flatten the curve. So until that happens, I think, you know, we're still waiting. And part of the thing here is, from my understanding, is the incubation period and how long it takes for this to manifest itself, and then, you know, how quickly it can spread as well. And so there's so many varying thoughts around this, and it's hard to know. I'm not suggesting that you know yourself, but try to understand how widespread it is without full testing.
Right.
How do we possibly get there? I mean, is it just a case of wait and see, and we need to be
Well,
patient about this?
yeah, I think in terms of new infections before symptoms develop, or even in patients who never develop symptoms but get infected, right now that's going to be tough to get a handle on in real time because of testing being limiting, and also discouraging people who don't have symptoms from coming into the doctor's office and not coming in for testing. So I'm sure that that what we detect by testing for active infections represent the tip of an iceberg. And that iceberg, we don't really know how big it is. And that's a compendium of people who don't have symptoms but are eventually going to have symptoms, and people who don't have symptoms and aren't going to have symptoms, which is really the population we don't know about. Now, I do think we will eventually figure this out. And the way that we'll figure that out, right now, the way testing works largely is by swabbing the nose of a person and looking for evidence of the virus that they are making in their little factories of cells in their nose and throat and lungs. Another way to ask a question of whether someone's been exposed to an infection is to look in their blood later, like a month later, for antibodies that their immune system has made against the virus. Those antibody tests are increasingly becoming available to see in any population how many people in this population have evidence in their blood that their body has seen this virus before, that they have been infected. So you could imagine that coming out of the back end of this, that the public health sector will go out and do a lot of studies asking in a population, let's say a collection of 1,000 people that live in a certain region, how many of those 1,000 people have antibodies in their blood for this virus? And then they will ask questions of those people to see, do you remember in the winter or the spring getting sick? Were you hospitalized? Did you ever have an illness characterized by cough and fever that you didn't seek care for, or that you toughed it out at home? And in that way, retrospectively, through the rear view mirror, we will get to understand what proportion of our population truly got infected, what proportion of our population recalls having symptoms or was actually hospitalized, and who are the people that were completely clueless that they got infected but actually did get infected. The problem is that those data won't come to us in real time. Those will lag. They will be really important. They will also help us, for example, understand who might be safest to go back to work first if they are in areas where there's still a lot of active infections. If somebody's known to be immune, they could possibly be redeployed. So that information will be really important. But your question is great, because right now we really don't know how big the iceberg is. We really don't know if you and I, talking to each other right now, have been infected or not. And that's the big challenge. And that's why we're doing this sheltered in our own places, is that we really, because we can't tell, we really shouldn't be out there interacting.
Yeah. I mean, I think there's a couple of things that kind of really made me think and gave me a bit of concern was, like you said, I mean, if you're asymptomatic, I remember there was, I saw one BBC journalist, and he was demonstrating a fingerprint test. And it turned out that he was asymptomatic, and he's been reporting on this and, in television studios. And he said, no, I'm just containing myself, in isolation. Because you start thinking, actually, how many people have probably got this? And then, even spreading it around as well, and thinking, well, I'm not showing any signs. So, yeah, I mean, on that point of like spreading this around, I've read a few articles in terms of like the droplets, and we talk about this 2-meter rule, but if you're talking, for example, we could be spreading it if we were within a certain range, as we talk. So I understand the importance of getting the masks and all the PPE equipment to healthcare workers. So failing that, do you think there's beneficial advice in covering your face with a scarf or a bandana or, whatever it may be, if you have to kind of go out and about, and is that going to help suppress the infection rate?
Yeah, I mean, you move pretty quickly from what we know to what we don't know. And what we know is that some of the medically appropriate personal protective equipment, or PPE, have been super tested in terms of their ability to prevent droplets from really being dispersed when somebody who's wearing a mask is infected, or someone who's in the room and these water droplets are in the air and you can't see them and they're wearing a mask. And we know from lots and lots of testing how effective those can be in protecting the wearer. Now we're into this sort of uncharted territory of saying, if everybody looks like an old Western cowboy movie wearing a bandana, how protected are they going to be? And I think, again, we're going to learn from this. It makes a lot of sense that if somebody is shedding this virus when they speak and they don't know it, that if they're wearing any kind of face covering, that could limit the dispersion of this virus into their environment. And when it comes to wearing homemade or cloth masks or even scarves or bandanas, probably the most effective way that those are going to slow the spread is if somebody who's shedding the virus is wearing one, because it'll keep the virus close to them. And if it gets out, it may get out going downward and not outward. So that's probably the biggest effect. The idea that if I'm breathing through a scarf or a handkerchief and you're infected and you're near me and you cough or you breathe on me, those particles can probably get through a little bit. We think there's some benefit to that, but we don't totally know the benefit of that to protecting the wearer, but it might. What would be important would be taking it off properly, laundering it, not letting it get wet or saturated so that you're actually sort of sticking it to your mouth, and then washing your hands after you take it off. The third way that these masks, these sort of homemade masks or improvised barriers can be helpful is that they provide, there's two other ways. One is they provide a really helpful reminder to people that, oh yeah, we're in a pandemic right now, and I probably should be keeping my distance from that person. So in that way, they reinforce the notion that the best way to prevent person-to-person spread is just to lengthen distance, and that's a good reminder. The other one, which is another maybe minor point, is that they help to destigmatize the use of masks. And sometimes people who have immune systems that are depressed or are sick have to be out in public wearing masks. And it's easy for them to be stigmatized or feel weird or worse. But if everybody's participating in that, then it really destigmatizes. And that's I think, something that is important.
Yeah, I think that's a good point. I mean, I felt a bit silly when I was walking my dog wearing one, but it's one of those things. I mean, you just realize actually, like you say, if I have it, I don't want to be spreading it around as well at the same point. And,
Yeah.
At least I'm minimizing the effects of, if it could get any worse. So yeah, there's a couple of more questions around this. I mean, one of the protocols that we've been advised here is that we're allowed out one form of exercise. Now, I find it a bit curious that when it comes to exercise, people are limited by their imaginations. They only think about jogging or cycling. They're like, there isn't anything else we possibly else could do, So, I'm willing to kind of share my thoughts on that. But if people are out and about, because I can understand you don't want to be inside and coop inside, and you do need to get some fresh air, let's say by change of scenery. Do you think it's a wise thing to be running or jogging or cycling, when other people are, like I said, I mean, they may be infected or they might not be affected, but what's your thoughts on that?
Well, I mean, first of all, I think for all of our mental health, let alone physical health, it's really important to be able to get outside. And it's also important when you're inside to understand that you're not alone and that you can use things like the internet if you have access to that. to be social, and telephones and smartphones and ways to connect. Staying connected and being connected is still possible in this time of social isolation. I do think getting outside is perfectly fine. In fact, the air outside is perfectly healthy and clean. And actually right now, pollution levels are even down because factories are shut down and there are fewer automobiles on the road. And so it's actually a really good time to be outside. In the public air, there's not COVID-19 virus just sort of hovering there waiting to attack people who are walking by themselves or with the people that they live with. It's really an issue of being in groups with people who you don't normally, that you're not domestic partners with. And that's where you're going to see asymptomatic transmission. And that's one of the reasons why, if you have to go to the grocery store or the pharmacist, that wearing a mask in those areas may be the most beneficial because you're in an enclosed space. I think running, riding a bicycle, or doing anything that engages in exercise out in public, as long as you're not doing that side to side or face to face with a strange person or someone who doesn't live with you, and you're doing it on your own or with your domestic partner, that's perfectly fine and safe in my view.
Okay, so that's good. That's good to know. I mean, I was just a little bit concerned. It's like they're breathing hard and they're running past you. It could be something that could be transmitted.
Yeah, I don't think there'll be enough particles of virus. Like if I'm walking outside, let's say I'm infected and even I'm symptomatic and I have a fever and I'm coughing and I cough into the air, and then, a minute later you ride your bicycle right by. There's really no biological reason why that would be a risk to get infected. I mean, you'd really have to be like, someone would have to cough right as you bike, and you'd have to, and that sort of thing hopefully won't be happening. But routine, just going through a park, keeping your distance from people, the risk of infection, it might not be totally zero, but it's almost as close as you can get to zero without getting shocked.
Okay. Well, let me ask you one other question, because I mean, this is something I've been fascinated about, is the 1918 Spanish flu. Because looking through history, I mean, it was well, I think from the reports now, they're saying they could potentially kill 50 to 100 million people worldwide. I think the original estimates were about 5 million, because the World War I was going on, and at that time there was a lot of propaganda. They didn't want to kind of detract from the war, and they still wanted, the whole thing about that. I guess I'm fascinated with that, because it's one of those times in history. You hear about the World War I, World War II, and how many people killed through that, but this alone, if those figures are true, killed more than either of those world wars. So it should be in our consciousness a bit more, but it almost seems to be hidden or marginalized for some reason. I don't know, maybe it's so painful, or it's a part of history that we don't want to remember, because it makes us feel very humble in the grand scheme of things, that we don't have control of, our destiny, so to speak. What lessons do you think we could learn from that time? And I mean, if you could share any kind of, studies or knowledge that you have pertaining to that, that'd be useful, I guess, to understand.
Yeah, that's such a deep question. And, I think as humans, we tend to be very forward looking. We tend to ignore the things that are behind us, and everything seems to revolve around making advances. And every modern era is quote unquote better than the previous one, more advanced. And yet we keep experiencing the same things, making the same mistakes. And I think there is a lot that we need to learn from our history. And as I get older, the more respect I have for really archivists and historians. They have told us for years that you can learn a lot about your future by studying the past. And this is a golden example of that, where we're now seeing in the press articles that people are happy to read to learn more about, wow, what happened in 1918, and even some social experiments for example, in the United States, when there were parades in different cities during the pandemic, and I think Philadelphia didn't cancel their parade and St. Louis did. And the difference in just the death toll and the morbidity between those two cities based on whether one city really locked down and participated in social distancing to the extent that they could, and another city that said, oh, this can't happen to us, and sort of rang of hubris, and then suffered the consequences of that. You know, back in the early 20th century, we didn't have vaccines like we do today, particularly for flu. We didn't have antiviral medications or antibiotics of note. And our best offense against something like the flu was really a good defense. It was really just the ability to say, wow, this spreads through the air. We need to wear masks and we need to not associate. And if we go back into these archives of history, we see the same sorts of things happening. Governments struggling with, you know, initially the denial that there could be any benefit of shutting businesses down, or, you know, the purposes of wearing masks or participating in social distancing, and even doing those things. Tens of millions of people died of the pandemic influenza, and one is left to wonder what would have been like if those things weren't activated. Now we're in a time where we still have those, what we might consider rudimentary fundamentals of public health, washing your hands and distancing from others. It could not be more simple. But we now have the ability to rapidly deploy drugs in clinical trials that might work. We have the ability to develop a vaccine or more than one vaccine and roll it out into clinical studies and potentially get it ready for use within a year or a year and a half. And we have the ability to communicate quickly to people. And so even if they are tucked away in their office and they're on their computer, they can see, oh, look, the laws have changed. My restaurants are closed. I need to get home. I'm not an essential worker or whatever. So we have this capacity to engage in public health like we never have before. But if we don't look back at what happened in the flu pandemic, we will suffer for that. And so I hope that one of the really good things that comes out of this horrible pandemic is a great example for our young people of the importance of listening to our elders and reading our history books and understanding that sometimes we've been here before, and sometimes the more things change, the more they actually stay the same.
Yeah, I think that's a really good point, you know, about history and, you know, learning the values of, you know, from the past and applying it to the future. I think we're going to pause there. We'll pick this up. I mean, I think there's so many more questions I want to ask you, but thanks for your time so far, and we'll carry this conversation on.
Jerry, beautiful to connect. Thank you.
Okay, thanks.